Does it initially begin with like not wanting to eat anything at all, or?
No, I mean, like I said, sometimes it starts at a young age. With younger children, they might have had an episode of choking. And so maybe there's something they don't want to now have solid, hard food or something. So it begins at a very young age. Some of these children might be initially categorized as picky eaters. Mm-hmm. This goes beyond the picky eating category. Yes. So you would see the texture is also something that they struggle with certain textures. So sometimes you'll see this is really diagnosed at a young age, sometimes prior to the age of 1. But there are cases where you do see they can meet criteria for this diagnosis later on.
Wow. Now we're going to talk about eating disorders that have to do with body image like anorexia and bulimia, but how often does avoidant and restrictive intake disorder get mistaken for something like anorexia, Janet?
Absolutely, it does. And so it takes you, again, to see the differentiate, and we'll discuss that as far as the differences, because again, body image being one of the key one of the key that differentiates the two diagnoses. But there's also a lot of other, when you notice maybe if they've had an episode or something happened to them relating to food, or the age of onset, meaning if it began at a very, very young age, you would obviously know that they're not trying to to lose weight at the age of 2 or anything, if they've had a history of feeding issues. So it's very different. You'd see the progression and the onset and when it began. You can definitely be able to differentiate if this is anorexia or if this is more of an ARFID.
If it starts at such a young age, is this something that a patient might carry on throughout their life?
Yeah, I mean, I've seen patients where in their adolescence, but early on, parents are really trying because, as you know, as parents, you try your best to make sure that you're nourishing your child appropriately and you're teaching them basics so that they can have the ability to independently eat on their own. So yes, but you do definitely see this later on, and it is something that you want to, as early as possible, to address.